Hello, it is Dr. Katwa here, and there is something I need to tell you guys, especially the consumers of our services, medicine. Now, if you get a doctor writing or else doing a prescription for you with so many drugs, yes, I'm talking about 5, 6, 7 different drugs, and in some cases, those the prescription has the company names in it rather than the molecule name of the drug. For example, emitino instead of saying ondansetron. I don't have to explain, you can check. What I've just described is called polypharmacy, when someone prescribes too many drugs for you, in some cases for a simple condition. So it could happen for a complicated, multimorbid situation. But if it's just a simple condition, somebody has prescribed you 5, 6, 7 drugs, that is called polypharmacy, and we really frown upon that. It's very bad. The most obvious reason why it is bad is that it is overwhelming your body, number one, and then number two, it could cause what we call microbial resistance if antibiotics are among the prescription. So if that happens, then there are around 3 or 4 reasons why it could be happening. So the first reason is that the doctor could be wishing to sell you expensive drugs. So in this case, it's just a simple case of fraud. So the doctor commits professional malpractice in an attempt to sell you a lot of drugs for the simple motive of getting more money from you. So the second reason why that could be happening is that the doctor may have been visited by another category of our friends called pharmtechs, who come from those companies. I told you earlier that it could contain brand names that sell these drugs, and they want the doctor to sell you as many brands from their company as possible so that they can make a lot of profit and make their investors or their shareholders happy. So the third reason why this could be happening is that you have a poorly trained doctor who is not sure about what he's doing and cannot target his symptoms or else the clinical symptoms that you are presenting to a specific disease well enough, yes, to have a prescription for you that targets those diseases. So he uses what we call in medicine a shotgun approach. As you all know, a shotgun is a gun that sends out a lot of pellets in a spreading manner, so that even if you don't know how to aim well, you will hit something. So in this case, the doctor gives you so many drugs, hoping that one of them will target something that you have. The fourth case, and this is your fault as the patient. Yes, you can be at fault as a patient as well, and it's not necessarily just you. Maybe the previous patients that were seen by the doctor gave complaints that, oh, I feel back pain, I have headache, I can hear voices, I have diarrhea. So they have very spread out symptoms. So the doctor maybe gives them an opinion, but they are not comfortable with that opinion. So when they come back to the doctor now feels like he has to prove something. Yes, so they do a big and long prescription. Another case is that a patient may feel inadequately treated if they are given few drugs. So it makes the doctor be under pressure to give a lot of drugs. And then also another case is that a doctor may just want to brag that they know a lot of new cutting edge recently developed drugs, and they want to show off. So I would say, as with many situations in life, the higher the level of training of a doctor, the more likely they are to target their drugs. And you get that lower level trained doctors will tend to create a scenario of polypharmacy more often than well-trained doctors who know how to target their symptoms and their medications better. What is the purpose of this video? Just to make you aware that when you get a polypharmacy kind of a prescription, that there could be 5, 6, or even 7 different reasons why it happens. And I've listed most of the reasons. So stay aware and always be on the lookout for a polypharmacy prescription. So is there a role for more than 6, 7, 8 different drugs in the same prescription? Yes, and as I've said, this is often a case whereby the patient has a multimorbid kind of a picture. So multimorbid means the patient has a lot of different conditions. Yes, and this usually happens for chronically ill patients and in some cases terminally ill patients. So enjoy your Sunday. Goodbye.